Hey everybody, thanks for joining me today. Dr. Ross Marcagiani with a great word of the week. Today's word of the week is going to be POTS, or known as postural orthostatic tachycardia syndrome. We'll be diving into what POTS is, what are the common symptoms, how does someone get POTS, and then how we support the condition. Let's dive in. So what is POTS? Postural orthostatic tachycardia syndrome, which I already said earlier. And basically, the name tells you what is happening here. So the P is the posture. So we know that posture is affected by this condition. Okay. Orthostatic means typically from a laying down position, right? And transitioning to an upright position. And then tachycardia is rapid heart rate. And this is a syndrome, so a compilation of symptoms. So again, what happens is we're in our posture affects our heart rate. We're in a laying down position typically. Some with a more severe condition can have this occur in a seated position, but we're in a laying down or supine or seated position, and we transition rapidly into a standing position, and that causes increase or rapid heart rate, tachycardia. And some common symptoms of this, obviously the tachycardia, fast or rapid heart rate. We could get fainting, we could get severe fatigue, lightheadedness, some chest discomfort, nausea, headache. In other severe conditions, sleep issues, blurred vision. And you can see on this chart here, it gives you some other symptoms as well: the dizziness, the sweating, the fatigue, the shortness of breath, the palpitations, which I talked about. And it kind of shows you with the blue being the blood right here in the chart. When you're in seated position, your blood is circulating throughout the entire body. And when you stand rapidly, there is a decrease in the autonomic nervous system. This is just when you hear autonomic, think automatic. Your body does this automatically, and it pumps blood throughout the body. But you see when they're standing that blue doesn't get to the shoulders and the head, mainly the head. That's where the mechanism of vertigo or nausea or fainting would occur. So the heart has to increase its pumping or the speed of its pumping to try to get blood pressure or blood circulation back to the head there. So that's what POTS is. So how does someone get POTS? Okay, so obviously you're aware of it's a lack of blood flow or inability to vasoconstrict, so that the arteries and veins to constrict, right? So we have dilation, expand, constriction is contract, and kind of like pump the blood through the hose in this analogy here, or pump the water through the hose. We could also have issues with blood pressure. So blood pressure, in certain cases, blood pressure may be too high, and just standing causes it to drop down. Or it could be on the other hand that the blood pressure is too low, so even just a minor change, the blood pressure is already low and it's not going to have enough pressure to squeeze. Typically a great test here is a supine or laying down on your back blood pressure reading, and then standing and then having a blood pressure reading directly upon standing. And typically what should happen is you have two numbers here. When you're having POTS or you're having some type of orthostatic issue, it's typically what happens is when you stand, your blood pressure has two numbers. You have a top number, which is known as your systolic, and your bottom number, which is known as diastolic. So when you see a 20, what's called millimeter of mercury, that's just a measurement, but a 20% or 20 digit drop in your top number, your systolic, and when you see a 10 digit or, this is also or, they don't have to be in conjunction, or a 10 digit drop in the diastolic, the bottom number. So again, your blood pressure, 20 number drop in the top number, and or 10 number drop millimeters of mercury in the bottom number, your diastolic. You can also measure your heart rate. Again, supine position to a standing position, you can measure your heart rate. Heart rate should be typically, with a conditioned individual, probably somewhere around 60 to 70, but normal is somewhere between 70 and 100 or 90s, in the 90s. Obviously, the higher heart rate, more deconditioned. But a heart rate from a laying down to standing position should be about a 10 to 15 increase beats per minute. So if you're noticing you're not having that drastic or that, not drastic, but that nice bump in heart rate, that could be another indication as well. There could be caveats, extremely well-conditioned individual, some other issues potentially going on, but that's a good test. So 20 millimeter drop or more, 10 millimeter drop of mercury or more in the blood pressure for your systolic and diastolic, or less than 15 increase in your heart rate would be all conditions or signals of postural, some type of orthostatic condition going on. Really important here. We talked about the regulation of the autonomic nervous system. So that really ties into the adrenal glands here. Because the adrenal glands, you can see in this picture, we have the adrenal medulla. And that's where your catecholamines are. Okay? And that ties into the autonomic nervous system. So that's our fight or flight response. So when we perceive this drop in blood pressure, where we're not having blood flow to the brain, the autonomic nervous system should fire, turn on, and start to vasoconstrict, increase heart rate, increase cardiac contraction, and increase heart contraction, and increase blood flow to the brain. Also, another piece of the adrenal glands, that's in regards to the autonomic system we talked about, but you can see here there's an outer layer of the adrenal glands called the adrenal cortex. In this outer layer you have three layers. One of the layers is called the zona glomerulosa. This holds and helps to regulate our aldosterone. Aldosterone helps to regulate blood pressure. So if we have adrenal fatigue, it can influence having low blood pressure or possibly high blood pressure. And then if we have poor autonomic regulation, that can also influence our adrenal glands. And things like that, they've seen like viruses. After dealing with a virus, you could have autonomic dysregulation. Certain autoimmune conditions such as celiac, Sjogren's have increased risk to POTS. But it's important to assess your adrenal function and your autonomic nervous system here. We can have issues with insulin resistance. So insulin has been shown to affect blood pressure negatively or positively. So if we have high amounts of insulin rushing into our bloodstream, this can affect how we regulate our blood pressure. And that would cause large variations of blood pressure, which we don't want. We want nice, normal, steady blood pressure so that we don't have drastic highs or we don't have drastic lows, which creates the POTS. And then there's a common connection with EDS, Ehlers-Danlos syndrome. This is another genetic condition. You can do genetic testing, but there are certain variants of EDS that are not found on genetic testing, but just wanted to mention a strong connection with that. And then also the thyroid. I know I have that with the autonomic nervous system, but if anyone watches my videos, they know from listening to my education that the thyroid and the adrenal glands are tied strongly together, and that the thyroid, there has been some research shown that thyroid can influence blood pressure. So how do we support POTS? Obviously, first and foremost, is good healthy nutrition. So whatever your diet is that you like, whether it's a DASH diet, a Mediterranean, a paleo, a diet that focuses on low blood sugar, good healthy vegetables, fruits, and good healthy meats and healthy fats, okay? With POTS, we want to try to avoid alcohol consumption and caffeine. Those can dysregulate our blood pressure and cause for some drops here. Just to be on the safe side, I'd make sure you get an EKG. That's an electrocardiogram, just to make sure that there's no underlying cardiovascular condition or heart-related issue going on. And then making sure we're supplementing with good trace minerals. Trace minerals should have sodium, potassium, iodine, chromium, zinc, selenium, and several more. So a good trace mineral can help stabilize the blood pressure. Assessing adrenal function is really important, but licorice root can help to bring up blood pressure if your blood pressure is dropping out. Just be careful if you're one of the patients who's suffering from POTS and you have high blood pressure. This would be a no-no because it will increase blood pressure further. Adaptogenic herbs such as rhodiola, ashwagandha, can help to normalize and balance blood pressure. And then if for an individual that's on the higher side of blood pressure and your blood pressure is dropping out too low, using like CoQ10, using L-arginine, using taurine, things of that nature can be helpful. But it'd be it'd be best to get proper assessment from a clinician and a practitioner to guide you along this path here. I really appreciate your time. If you know anyone that's dealing with this, please share this information, and you have a wonderful day.